In this video, why can pelvis asymmetry or lateral pelvic tilt cause lower back scoliosis, hence lower back pain? Recently, I've seen many patients with a similar pattern of torque in their lower back. In most cases, the causes are identical, yet many were unaware of it. I will demonstrate the causes of that condition. At the end of the video, you'll see the bonus exercise that you could start today.
How your lower back scoliosis is being formed because of the lateral pelvic tilt. Why the left AAC pattern or pelvis asymmetry is actually causing your lower back curvature to the left side or maybe towards the right side.
I'll also explain the principles of addressing this issue. Additionally, you'll see both my personal results and those of my patients concerning this problem. Let's slowly dive into it. Firstly, there are so many types of lumbar curvature that I can't even count them all. Today, I'm only going to describe the functional curvature. This is a reversible type of scoliosis caused by poor function. So once you restorated a pelvis position, you may fix your lower spine as well. The dynamics of the hips always determine the direction of the spine. For instance, normally when we walk, our spines should deviate about 3-4 degrees away from the supported leg. This means when you reach the right mid-stance, the spine naturally moves just a bit towards the left side and vice versa. Take a note, this only occurs when we move forward. When you simply lift your hip while standing, it does not apply to our today's topic. At times, your brain becomes overly dominant on one side of pelvis over the other. You might wonder why. After major injuries or imbalances or surgery, the brain starts to over-reference one hip over the other. The body starts to overuse certain chains of muscles, which leads to the formation of a lateral pelvic tilt or left IC pattern.
You got stuck on the right leg, and because of that bad pattern in which you got caught yourself, your lower back is being deviated to the opposite side. Because of that, your brain is recognizing that you are being cemented on the right lower limb more than your left limb.
Consequently, the spine stops its natural deviation cycle from left to right. Once again, since your pelvic got stuck, your spine also got stuck. Usually, when you have pelvis asymmetry to the right side, your lower spine can curve to the opposite left side. It does not mean that everyone with tilt pelvis will have it, but when you do have it, you will see your spine being curved. Big surprise. Not every X-ray technician can point that as a problem. Usually, scoliosis and pelvis tilt will have following symptoms. It's very conditional, but one-sided groin pain, one-sided lower back pain. Usually one half of the spine will be more tight. Traps and neck can be involved as well. Now please take a look on my patient. I've already posted her on my channel. She got that lumbar curvature to the left side as a result of the chronic spine injury. She could not walk like a normal human being. But after 2 months of therapy, the pain disappeared and her spine got straight. At this picture, you can see a hardcore case. This is a young man, 20 years old, because of his pelvis being twisted to the right side for more than 2 years. He developed a compensation where his upper spine was turned to the opposite left side, which created a rib hump. After many years of struggle, the postural restoration exercises were applied, and you can see the full resolution of it. Can you guess already who was there? That's right, this young man was me. So apparently I have a lot of experiences in lumbar scoliosis. I can help you with similar problem. Let's work under online coaching, or in-person meeting in Poland can bring you even more value. Click the link below to start the treatment. Although I sound like a broken record emphasizing that the pelvis should be fixed, it's actually your brain that needs to be fixed. Your brain and nervous system need to feel that the old way of walking is safe and not threatening. In reality, you have to retrain yourself and many muscles to walk properly again. What's the typical solution? As I mentioned, certain chains of muscles impact the position of the pelvis that ultimately drives your spine. To solve this puzzle, we would need to engage the opposite chains of muscles that are responsible for moving the pelvis to the opposite side where it initially was. The treatment typically involves 4 stages. The first step is to neutralize the extension of the lumbar spine. Next, you need to establish the correct left hip shift. What does this mean? Basically, when you are in that pattern, no matter how much you stand on the left leg, it will not create the correct alternation between the pelvis and spine. Initially, you might need to overcorrect your left hip shift. This involves a significant amount of left femur internal rotation and adduction inside the hip socket, so you can rebuild the anatomical correct left stance. Sometimes it's necessary to open up the posterior capsule of the left hip joint. Because when you have been too long in that pattern, this capsule gets tight. Without opening it, you will not be able to achieve a correct left stance, only compensatory one. The fourth step is to train the left internal oblique muscles to push the lower spine towards the right side. Lastly, you should use the right hip flexors to derotate the spinal column because part of the problem also involves rotation. Actually, without rotation, you cannot fix neither pelvis position or lower spine curvature. Each exercises will facilitate some phase of walking that you have lost. For instance, when you do this exercise, you have to use your proximal fibers of iliopsoas muscles to derotate the spine. Right iliopsoas activation will literally pull your spine column towards the right side. Naturally, this movement's occur during the right phase of gait. But when you are in the pattern, it means it happens not at full range of motion. So in a nutshell, that's how you can solve that problem. Of course, I've oversimplified things to keep this video short and concise. These are simply principles for treating typical non-pathological scoliosis. Don't regard it as a strict protocol. In reality, there are hundreds of exercises to choose from, and there's a steady progression. Overall, it might require 20 or even 30 exercises to see improvement over a few months period. First, lie on the left side of your body. Place a large hemicylinder under the gap between your left ribs and left hip. If you don't have a hemicylinder, find something similar in size. Make sure it's not too soft, like a bed pillow. You can place a pillow under your head for support though. Next, flex your left hip forward. Your right leg should be extended and aligned in a straight line with your body. Remain in this position for 2-3 minutes. With each inhale, try to expand your right chest wall, just as I do. Pay attention. It's forbidden to let your right hip fall backward. Keep it positioned forward at all times. This exercise passively compresses your left side, contracting your left inner abdominal muscles. It also relaxes the right QL, quadratus lumborum muscle, and the right inner abdominal muscle. At the end of the day, it reverses the left AIC pattern and shifts your lumbar spine to the right side. Do this exercise at the end of each training session for 2-3 minutes, or you can also perform it throughout the day when you're resting in bed. For instance, aim to do it 3-4 times per day.